The U.S. Surgeon General this week issued an advisory that gun violence is a public health crisis. This as the country dealt with yet another summer weekend marked by mass shootings, leaving dozens of people dead or wounded. Joining us now is Will Humble, Executive Director of the Arizona Public Health Association. Will, good to see you here. Thank you. This idea of gun violence as a public health crisis, what do you make of it?
No, it absolutely is and has been for a long time. I mean, let's take fentanyl and opioids as an example. Pretty much everyone recognizes that as a public health crisis and has been for a long time, many years. Firearm deaths and injuries is on par with that. And so in Arizona, we have 4 people per day dying as a result of a firearm injury accident. It could be homicide, suicide, or accidents. So that's the same as opioids. So this is a public health crisis and has been for a long time.
This was not an emergency declaration. It was an advisory. What's the difference?
So there's an emergency declaration that's like COVID-19. So that gives the Department of Health and Human Services a whole bunch of extra authority that they don't normally have. So this isn't that. The next level down is a Surgeon General report. And that's the kind of thing like this they did in 1964 where they said smoking causes cancer. So that's a Surgeon General report. This is an advisory, so it's a next level down. It's really more of a tool to educate the public and policymakers about the importance and the impact that firearms have on our society.
No regulations involved in something like this.
Correct.
Okay.
Right.
The role of public health in mitigating gun violence. I think a lot of people still have a problem putting gun violence with public health.
Yeah, well, the core part of public health is identifying a public health issue, or in this case, crisis, looking to the literature to figure out what are the effective interventions that can stem the tide of those deaths. Sometimes that's scientific, where you're looking at medical research, looking at vaccine development. Sometimes it's public policy interventions that you know are what would really stem the tide of these deaths. So in this case, with firearm injuries and accidents, public health's role is to look at what is the impact that various state laws have on what happens on the ground in terms of homicides, suicides, accidents, and injuries with firearms? So you identify those laws that work and that do your advocacy to try to get those implemented.
A lot of data collection, a lot of best practices, in other words.
Correct.
Okay. Background checks, safe storage laws, as you mentioned, interventions targeting high-risk people. These are the kinds of things that are looked at and analyzed?
That's correct. They work. The states that have those laws in place have measurably, significantly lower, not just homicides and accidents, but also suicides. So I look at those 3 foundational laws that you just said as that's the real cornerstone. Those 3 work really well together. So, so much of the public debate is about bump stocks and the assault rifles and that kind of stuff. When you dig into the evidence and say, what can we actually do to save lives? It's safe storage laws, child access prevention laws, red flag laws, severe order of protection, people who really shouldn't have a weapon, and and
obviously data collection and these kinds of things. How does this coincide with a report that you guys did as far as gun violence in Arizona is concerned?
I read the Surgeon General's report and it was spot on. Like that report we talked about a year ago here on the show. I mean, it's right. The recommendations in the Surgeon General report are almost exactly what we have in our report.
So with that in mind, how much of a difference does something like this make in the grand scheme, especially when the political winds aren't necessarily blowing in the same direction?
You mean the report itself?
The report, and it's Surgeon General's report. Let's get back to the Surgeon General's report. What difference does it make, Will?
I think it can make a difference in certain states that have state legislatures and governors in place that are receptive to looking at evidence and passing laws that about firearms and so forth. And we're not going to know if that's the case until after the November election in Arizona, but it's actually the reason why we wrote our report is the same reason the Surgeon General wrote his report, is that if we're able to get a legislature that wants to tackle these issues, our report gives you the evidence on homicides, suicides, accidents, injuries, police shootings, school shootings, and gives you the interventions, the laws that exist in other states that we know work.
So how was the reaction to your report?
Tepid. I mean, we came on to Horizon and talked about it. I passed out a copy. We made hard copies. I brought them to every single legislator down at the state legislature. Jen Longdon, former Representative Jen Longdon, had 8 bills that are many of the foundation, including all the foundational laws, never even got a hearing.
Yeah, so you just wonder if it's catching on or not.
Not yet. But our report's there, and if the legislature changes, and if that matrix, whoever's in there next year, is interested, we've got all the data for them.
All right, Will Humble, you got all the data for us too, and we appreciate it. Thank you so much.
My pleasure.